Hi, my name's Sherry Heenan. I'm an orthopedic and pelvic health physiotherapist, and I've had a lot of questions lately around how to massage your cesarean birth scar. When there's a lot of scar tissue formation around that incision, you can have issues with pain, pain with intercourse. You can have bladder symptoms such as urgency and frequency. So I'm going to give you a little video today on how to release that scar. First off, you want to make sure your scar is healed, which is usually around the 6-week mark. And many women prefer to work around the scar first before working directly on the scar. So what you're looking for are areas of tension, tightness, burning, maybe a little bit of tenderness there. And that usually indicates that there's some kind of restriction that you want to release. You're also paying attention to the sensitivity of the skin, whether it's more sensitive than usual, or perhaps there's a little bit of numbness, both of which are extremely common postpartum. So if you're working around the scar, you're going to start with your hands above the scar and just kind of checking the direction of the tissues back and forward, up and down. And you can also do some tiny circles. And if you come to an area of tightness or tenderness, you're just going to hold on that spot with gentle pressure, not reproducing too much pain, and just holding that, breathing into it, and allowing that tissue to soften. And you would do the same thing below the scar as well. Again, feeling cross right to left, up and down, or doing those small circles, feeling for those restrictions. And then if you find one, you hold that pressure, allowing your body to relax, breathing into it until you feel that kind of melt away. When working directly on the scar, we want to focus on the 3 different layers of connective tissue, the 3 main layers. The first layer, which is the most superficial, that's primarily our skin layer. The second layer is a lot of the muscle component. And then our third and final layer is the visceral or organ layer. So that's when we're getting deeper into the tissues. You also have a connective tissue called fascia that runs throughout each layer and between each layer. So we're affecting the fascia. So when I'm starting to work on that first layer, I'm placing my hands along the scar and I'm just kind of playing my fingers like I'm playing the piano, just to feel if there's any areas that feel more firm than the others, or maybe it's creating a little bit of tenderness. So if there's an area, you can kind of focus your attention on that area, or you can work the scar as a whole as well. Once you find that restriction, again, you can just do pressure and hold and allow that to soften and release. So that's the first layer. You can also do something called skin rolling, which is where you want to pick up the tissues around the scar and you're just rolling it between your fingers back and forth. It looks like I have a little bit of restriction right here, close to the middle. So I'm just trying to pick up that skin and just roll it around, loosening up from the tissues underneath. And I would do this for a couple of minutes. For the second layer, you're doing exactly the same thing, but now I'm pushing a little deeper into the muscle layers. I'm kind of feeling the scar as a whole, or again, I can kind of play those little piano keys to see if there's an area that's a little bit tighter there. Once I find that restriction, I can hold in that direction, allowing it and just following the tissues as they soften. And then the final layer is our organ layer. So I'm just going to bend the knees here. It takes some of the tension off. And I'm really kind of sinking into the tissues here, being very gentle, never reproducing any significant pain. And I'm going to check different directions to see which direction feels the tightest. To me, it feels like the left. So I'm going to keep that pressure down, and then I'm gliding my tissues to the left because that felt the most tight. I'm feeling a little tugging on the right side of my hip here. Again, it's not painful. It's just a sensation that I feel. And I'm just holding this, breathing into those tissues and allowing those tissues to relax and soften. And that's it. If you have any questions, reach out. Thank you. So that is how to release your cesarean birth scar. You can use these same techniques for any scar, which I do recommend if you've had some kind of surgery. Just be mindful that you don't want to reproduce too much pain, and you do want to make sure the scar is healed before you start. Thank you very much. Bye.